Thank you, Leapfrog, for inviting me to your video series. My name is Tracy Watts, and I'm a senior partner at Mercer. And I'm here today to talk to you about the recent announcements that have been made by the insurance companies that they will waive cost sharing for all of the COVID-19 care and treatment for their insured plan members. And so what this means is that self-insured employers are being asked to choose whether or not to waive cost sharing, which would include your deductibles, co-insurance, and co-payments, specifically for the coronavirus treatment. And just as a reminder, the CARES Act that was passed earlier on in the pandemic requires first dollar coverage for testing and for vaccines. That mandate did not apply to treatment. And so naturally, we're getting questions from everybody, what are employers going to do? So I just want to start by saying that we know that many companies are already struggling with the business aspects of COVID-19 and facing the prospect of furloughs or layoffs. Maybe you've already had to do that. So any decision like this is going to result in additional cost, and it will be weighed very carefully. So to answer the question, what are employers going to do? Last week on April 2nd, we asked approximately 650 self-insured employers about the likelihood of waiving cost sharing for treatment. And what we learned was that 37% said that they were very likely or likely to waive cost sharing, but 24% said that they were unlikely or very unlikely to do so. The real important number to know is that 39% hadn't begun to answer the question to make up their minds. And that's a lot of people that are undecided or not willing to share what they're going to do. So if you're in the undecided category, I thought that we would cover some things for you to consider. The first is always, what is the cost of waiving member cost sharing? The cost impact will depend obviously on your plan design and what services get used, but it's important to keep in mind that the majority of people who seek treatment will not be admitted for inpatient care. So according to our actuaries, the annual financial exposure of making this change under most scenarios ranges from 0.1 to a 0.5% increase in the claims costs paid by the plan. The second question that we get is, are there any compliance issues that we need to consider? And just as a reminder, as it relates to your high deductible health plan and HSA compliance, the IRS has already relaxed those rules for COVID-19 treatment so that 100% coverage does not impact your HSA eligibility. Now, covering the COVID-19 treatments without copays or co-insurance may require you to revisit mental health parity testing for next year, unless the regulators provide some relief from this compliance issue, which, you know, it would seem logical that they would, but, you know, we'll have to wait and see what happens there. So what about the time frame? The cost sharing is waived only until June 1st in the scenarios that I've seen, which seems a little arbitrary. And so, you know, what about if COVID-19 continues into June, or what if it returns at a later date? You know, will you have set a precedent? So that's definitely something to consider. And I would encourage you to ask about quality controls. Of course, this is Leapfrog. We need to ask about quality. So if all of the claims are going to be paid at 100%, can employers be sure that the adjudication process doesn't skip important business controls? And how will the carriers audit for quality or for fraud? And lastly, some employers that we've spoken to have raised the question of equity. How can they justify waiving cost sharing for COVID-19 and not for other serious life-threatening conditions? And while this is certainly a question that can be debated, one important difference is that COVID-19 is a mass contagion with enormous societal impact. And the steps that we take to control it benefit all plan members, even those who don't contract the virus or need to seek treatment. So I hope this has been helpful. We are all in this together.